Welcome back, everyone. I'm Julia, your host of the Mentorship podcast, a series that features diverse industry professionals. We mentor you by highlighting different fields and going through our guests' academic and career path, from high school to their current role. In today's episode, we are joined by optometrist Dr. Neety Kochar. Neety completed a bachelor's degree in life sciences with a minor in biochemistry from McMaster University. She then went on to earn a Doctor of Optometry from Illinois College of Optometry. In this conversation, we discuss the path to becoming an optometrist, including internships, rotations, and so much more. Neety also describes how she expands her horizons outside of the clinic and continues to find inspiration in her career. So now, here to mentor you, it is Dr. Neety Kochar. Welcome, Neety, to the Mentorship podcast. Thank you so much for being here. How are you feeling?
Thank you for having me. I'm great, thanks. How are you?
I'm great. I'm so happy to have you on. You're our first optometrist on the podcast, and I know that a lot of people in general are very interested in medical school. Mm-hmm. It's such a big aspiration for a lot of people when they're younger. So I'm really happy to have you on and to give your insights.
Of course. Thanks for having me.
Yeah. My first question for you. What did you want to be when you grew up, and what kind of things interested you when you were younger?
Yeah, no, for sure. When I was younger, I'm talking earlier than high school, I didn't really know at that point what I wanted to do. I considered teaching. I liked the concept of interior design. But those were all very early thoughts that I had. It wasn't really until I got to high school and then about into probably grade 10 when I started taking more of the science classes that I realized, I think healthcare is where I want to pursue. So yeah, I would say high school was probably the pivotal point.
And so besides the sciences that you were taking in high school, were you doing anything else to kind of narrow down your interest more in the healthcare field or medicine? Were you volunteering somewhere or maybe co-op that kind of got you more exposure, or just the science courses at first?
In high school, it was mainly just the courses I was taking. I did look into other extracurricular opportunities when I got more into undergrad. That kind of solidified which stream in healthcare I wanted to go into. High school was just more of a generalized, I don't want to do healthcare, no idea what stream yet, but healthcare.
Yeah. And it's so early still, right? But
yeah,
I'm such a big advocate for taking the science courses because they really keep your doors open, especially for undergrad, because there's some majors and programs that you have to have those science courses for.
Right.
So yeah. I think it's great, even if you don't really know yet, maybe you're interested in healthcare, at least you have those options.
Right. Yeah.
So then when you were looking at universities and programs, what options were you looking at there, and which one did you end up choosing?
Yeah, so I think all the programs that I applied to were either health sciences, life sciences, biomedical sciences. I remember I applied to Western, U of T, McMaster, a bunch actually, but they were all within the life sciences, and ended up choosing the program for the life science at McMaster.
I remember being an undergrad too. I was in sciences at TMU, but a lot of people were very interested in the life sciences at McMaster. And I actually had a couple of my friends who ended up leaving to go there because they switched programs. So I'm wondering if you could kind of give us some insight into this program, why it's something that so many students are very interested in too, and if you can kind of give an understanding of what it was like for you.
Yeah, for sure. I had heard a lot of great things about McMaster. I had some friends and some family members who had already attended Mac. So I think that definitely played a role. I know Mac overall is a great school. They've got a great health science program overall. And to be honest with you, it was also a matter of just visiting the campuses. When I went there, I really liked the community feel that the campus had. And so that's what I narrowed it down to. The program itself was great. Obviously, it's pretty intense, like most undergrad programs are. It's a big jump from high school. Yeah. But most of the courses involve the biochemistry, the organic chemistry, the physics, a lot of biology, kind of just the generalized sciences.
Mm-hmm. And then as you got into your upper years, what kind of distinguished you as a life science major? Because for me, coming from chemistry, we also did a lot of those courses in first year, but then I specialized more in the chemistry courses later. So how did you kind of get more distinctive with the life sciences?
I think the life sciences was more of a generic degree, where as long as you take an X amount of science courses from that category, you'll graduate with a life sciences degree. And then if you honed in on a specific type of path within that, then you could minor in something. So for instance, that's where I did a minor in biochemistry. I had a particular interest in that field. So yeah.
And biochemistry is tough. I would love to hear why you chose that, because even as a chemistry major myself, I stayed clear of biochemistry because it was difficult for me. I could not really grasp it was a lot of proteins, DNA, stuff like that, right? So what was it about biochemistry that you really liked?
You know, it's a great question, because I remember in high school, I actually found like grade 12 chem to be a lot more challenging than biology. But in undergrad, it was different. I actually I was just able to understand chemistry from a biological perspective just so much better. And it really is just something that I felt came easier to me than physics, let's say. But I think it was just something that I was good at in a way, so I just stuck with that.
Yeah, I think that's what's nice about a general science program, especially at the beginning. You get to try different ones and then see which one sticks with you, and you can go on with that. You also mentioned that in undergrad, you started taking some extracurriculars and maybe getting involved in clubs, things like that allowed you to explore medicine more.
Yeah.
So what was that process like, so that you could start to see if you were indeed interested in going on to med school, and what kind of med school you would be interested in as well?
Yeah, so there were some clubs that were available to students who had an interest in healthcare but didn't know what stream they wanted to go into. And so they would hold like general information sessions about pharmacy or about dentistry or pre-med. So those were helpful to go to. I probably didn't actually start to actually volunteer and have a paid job within the healthcare field until my third year of undergrad.
So what was that in?
So basically, like what happened, life sciences, it's a general degree. So in terms of, most people plan to do something afterwards to kind of hone in on one specific field. And so, third year undergrad, actually my dad, he played a big role in my career. He brought up to me, he's like, you're in third year, what do you want to do after this? And I was like, I don't know yet. And then he's like, well, the only way you're going to know is if you get out there and, start volunteering, or you look for like a job. And I was like, you know what, he's right. So third year, I was living off campus. I gathered a bunch of my CVs, and I went out one day and gave my resume to a hospital, to a family care practice, an eye care clinic, pharmacist, and then I ended up hearing back from the eye clinic. And it's funny, of the list of clinics that I had given my resume out to, I didn't think I was going to hear back from the eye clinic for some reason.
Yeah, and then that's the one you did.
Yeah, and so that's where I heard back from, and it was actually just right next door to where I was living, so it couldn't have been more convenient. And then it was actually a great experience, because the doctor that was working at the clinic was actually an ophthalmologist. So it was great that my first experience, in terms of gaining extracurricular, was with an ophthalmologist. I think it was, I just got really lucky.
And what's the difference between an ophthalmologist and an optometrist? So
an ophthalmologist they're almost they're like the secondary eye care providers, and then the optometrists are more like the family physicians of eye care, where you'll go to an optometrist first for your basic eye care needs. They'll diagnose you for your glasses prescription, your contacts, if you got a basic infection or a red eye, cataracts, things like that. They'll be the first line of defense to find those issues out, and then if you need further care, like something surgical, we refer you out to ophthalmology for that. Yeah.
So that's a great experience that you were able to get really exposed there.
Yeah.
What was it in particular that really you felt like you resonated with optometry at this position, as opposed to maybe wanting to explore other fields? What was it there?
I think a lot of things just kind of fell into place at the same time. I actually, I think like most people didn't know much about the eyes at all. I had also been used to going to the optometrist and have them saying 1 or 2, 1 or 2. And I was like, okay. And then when I got this job and I realized just how complex the eyes are, I was actually really fascinated. And being behind the scenes and watching this ophthalmologist, come to her findings and, just learning how even like the results come to be, I was like, it was fascinating to me. At the same time, my father, he works for the National Research Council of Canada. So he was actually working with a client with the CNIB, which is the Canadian National Institute for the Blind. And at the time, now this is this is a while ago now, I'm thinking like 2008 probably, they were developing keyboards for the visually impaired with Braille. And so my dad was helping to fund that project. And that was around the same time that I had picked up this job with the ophthalmologist. And so I think everything just kind of came together and I was like, the eyes are just absolutely fascinating. Yeah. And so, the rest was history.
That's amazing.
Yeah.
So then as you're going through undergrad and starting to figure out where you want to specialize, what were your plans to prepare for either med school or optometry school afterwards? Did you have to take the MCAT? How did that go?
Yeah, so optometry actually has their own test. It's called the OAT, which is the optometry admissions test. So there is some similarity to the MCAT, and then there's some sections that are quite different. So I started preparing for that once I knew that that's the field I want to go into. It probably took me a couple months to really study for that. Practice tests, flashcards, textbooks, you name it. Yeah. And then also getting my letters of recommendation in order because that was really important. I had also been able to pick up another assistant job in North York with another optometrist. So just kind of getting all of that lined up. It was, in addition to your GPA and all that. So,
right.
Yeah.
For the references, I guess you were looking to the optometrist or ophthalmologist that you were working with. And that's so great too, because it's nice to have diverse if you're able to get a professor in and then also like an ophthalmologist in the field. It really shows that you've already been so active.
Right. Yeah.
And they can speak on your credibility too. And were those positions, were they volunteer positions or were they paid, as I mentioned?
So I was lucky enough to get a paid position at both of them. But, I was more than happy to do a volunteer because it's more so about getting the experience in because schools really want to see that you've worked in that setting, what it entails. Yeah. So, I would have been grateful either way. I was just fortunate to get a paid position.
Yeah. And so you were basically like the assistant, I guess.
Yes,
That's
exactly.
Great.
Yeah.
That's great to know that those kind of positions are out there for undergrads to look into.
Absolutely. Yeah.
For the OAT, I think standardized tests can be very intimidating for students, whether it be the MCAT, the OAT, even LSAT. So I'm wondering if you have any advice on how you can prepare for that, specifically for the OAT.
There's so many guidebooks and preparation books that are out, and they honestly are really great. I know that I use those extensively during my studying. In what you take away from undergrad, there's a lot of overlap in that as well, of course. And then doing the practice tests, the flashcards, they kind of all come with the package when you purchase like an OAT prep course. That was really helpful. Even just, I wasn't really able to find too many people in person who were studying for that, but online there was so much material, other students who were studying for the same thing, and there'd be threads there that you could communicate in. So that was helpful.
That's good to know. And that could be tough too if your peers in undergrad none of them are going through the same process as you. Yeah. Because I think with life sciences, from what I know, a lot of people do want to go to med school after that. Yeah. So there is that maybe camaraderie with med school and people studying for MCATs, they could help each other. But that could be hard if you're kind of on your own trying something different.
Right. Yeah. For sure. There wasn't as many people who were applying to optometry. And so that made it a little bit more challenging.
Once it was time for actually sending out the application, what schools were you looking at there?
For Canada, the only English-speaking school is Waterloo.
Okay.
There is another school in Quebec, which is at Montreal, but it's a French-speaking only, so it doesn't really apply to those who can't speak fluent French. My French is not bad, but it's not good enough to be learning biology and physics in French. So Waterloo was the only option for Canada. I knew that I wanted to have other options as well, and so I did apply to a couple schools in the States, kind of just south of the border of Ontario. So Pennsylvania, Chicago, Boston, those were schools I also applied to as well at the same time. And then, once the applications went out and, my interview request came in, I settled on Chicago.
And what was it about the Illinois College of Optometry that led you there?
Great campus for sure. I loved their eye institute. So when I'd gone to Chicago's interview, I'd already done 2 prior to that. Again, all great schools, but I loved the setup that Chicago had. It was also a little bit more modern. I felt that their equipment was a little bit more up to date. And I thought the interview process in general was a little more welcoming, and I think that made all the difference for me.
And then what about the transition to the US? How was that for you?
That actually wasn't so bad for me. I remember going to Chicago when I was a lot younger, and I loved the city as a kid. And so I was super excited, to be honest. The transition was good. Like, my family and I, we drove down. It was like, I think 6 to 7 hour drive down. Yeah. They moved me into, the first year residence. As long as you have like your visa and your paperwork, that takes some time, of course, when you're moving to the US. But other than that, I didn't think it was too tough.
That's great. And it was right in Chicago, in the city?
Right in the city.
Nice.
Yeah,
nice.
Yeah.
Can you also describe your program and just how it was, the lifestyle in the optometry school in Chicago as well?
Yeah, absolutely. So I think most schools have a 4-year program, and Chicago's program was no different. The first year was kind of just generalized anatomy, and it was just a lot of material that's thrown at you first year. So you don't really hone in on ocular theory too much. Most of it is just, understanding multiple body systems. There's a little bit of exposure to clinic where you're pretty much going in and just observing and attending, conduct an eye exam at the institute next door. And then you just, it's mainly you're just watching in a very passive way. So first year is really just about content, like really throwing anything that they can to really make sure you absorb everything. First year I felt was probably the most intense, just because, I think they're also doing it intentionally to see if you can, if you're built for this.
Yeah, a lot of programs try to weed out people, which
absolutely
is controversial. But.
I'm with you on that. And I think, graduate programs tend to have smaller class sizes anyways. Like undergrad, I think you're used to like 500 kids in a lecture hall. I believe at the time ICO was only accepting like 120 kids. I think it's a little bit more now. And, you become very close as a class by even a couple months in. And I know that at the end of the first year, unfortunately, we had lost 10 people, just because either some people just realized they're not cut out for this, or, they're not getting the grade, or they're not built for that lifestyle. So they, second and third year were a lot more clinical. We had more exposure working with patients under the supervision of an attending. Okay. And then also our theory became much more ocular based. You're looking more like at ocular anatomy, binocular vision. It became much more focused to the eyes. Fourth year is just all clinical rotation. So at this point, you're just seeing patients for the entire year. And then you basically go through 4 different rotations, so 4 different sites throughout the year.
Okay. So what kind of rotations were you doing there? Because were you able to get aspects of different types of optometry through those rotations?
Yeah, absolutely. So that was really important for your program, to make sure that you've kind of dabbled in all specialties of eye care. So my first rotation was in Las Vegas, Nevada, and that was working in primary care at a group practice. So that was my first rotation. I was there for a few months. It was great. I mean, when it's your first rotation, you are a little intimidated, but then you get the hang of it pretty quick. My second one was more, that was in Daytona Beach in Florida, and I was working at the Williams V. Chapel Veterans Hospital. And I think of all 4 rotations, that was probably my most rewarding one. Just because it was really nice to be able to work with retired veterans, and give them the care that they need, because oftentimes, especially in the States, veterans can sometimes be overlooked. So it was nice to be able to give that care to them. And that was mainly focusing on ocular disease, ocular pathology, and like low vision rehabilitation. So that's where my focus was for that one. My 3rd rotation, I was lucky enough to be able to come back to Toronto. So the place that I had worked at as a student when I was an assistant, they had very graciously allowed me to come back and do a rotation there.
Nice.
So that was, again, a little more primary care, cornea, contact lens. And then my last one was back in Chicago, and that was more pediatrics and vision therapy.
So that's awesome that you were able to go to different locations too, because through that you could kind of test out different places, see if you would want to live there as well. Like, it just kind of gives you perspective on so many different things.
Absolutely, yeah.
So when it came to the type of optometry that you were doing, was there one that you felt like you resonated more with and saw yourself doing long term?
Yeah, I think for me, ocular disease and primary eye care were the 2 that I seem to resonate most with. And, even just in general eye care, like when you start practicing, you're going to see a little bit of everything. Like, you can't really avoid that. And I mean, we're trained to do everything. But I think majority of the patients I see now are primary care or ocular disease.
Okay.
Yeah.
And when it came to those rotations too, how were you able to secure them and find them, especially if it's cross country or, international, coming back to Toronto? How, I guess the ones in the States, did they have some sort of setup for how you could locate your rotations, or you had to do that on your own?
So thankfully, ICO was really good that way. 4th year, like end of 3rd year, they just sit the whole class down and they make us go through this entire process. They give us the entire list of externships that are available. They also give you the opportunity to bring your own in and to see if they qualify. And then it is based on a number system. So, depending on what number you are in the list, you pick whatever's left. Thankfully, all the ones that I got, I was very, very happy with.
Yeah, that's amazing.
Yeah.
Okay, so then as you were finishing optometry school, what were your plans for when you graduated?
So upon graduation, Canadian students did have the option of staying back an extra year if they wanted to, called an OPT program, which allows you to just work for a clinic for a year. And then the goal is you get sponsored by them and then you can stay. Right. I had plans on coming back to Canada. There was also the option to pursue a residency, but residency in optometry is optional. Okay. And so I was like, if I'm just going into primary care and ocular disease, I think I'm okay without one. So I came back to Canada. Now at the time, Ontario's licensing requirements required you to take Canadian boards, whereas now Ontario accepts the American boards. Okay. And so I was American board certified, but I had yet to do my Canadian. Right. So I took those. Now the thing is, like, Canadian board exams are only offered like once a year. So I was like, I don't want to be sitting at home doing nothing while I study. I think I can do both. So I looked for some work opportunities in between, and I was lucky enough to get a research opportunity at the School of Optometry at the University of Waterloo.
That's awesome.
Yeah, they've got a department. It's now called the CORE, which stands for the Center for Ocular Research and Education. Okay. Back then it was called the CCLR. So I was there for just under 2 years. And yeah, I was just, happy to do ocular research while I'm studying for the board exam.
Yeah. And so was this your first time being exposed to a research environment too?
It was.
Okay.
It was.
And what does ocular research entail? What project were you working on?
So the primary focus at the core was to understand the effects of biomaterials on the front surface of the eye, in particular contact lenses. So really understanding how contact lens wear can lead to pathology over time, understanding how those materials interact with the interface of our eye. So that was primarily what all the studies were focused around.
And how come you chose research then during that transitional period? Did you also have the option of working at a clinic? Was research something that you intentionally wanted to give yourself exposure to?
Yeah, the only other options that would have been available to me would have been more of like assistant work or tech work. And I think I had done enough of that prior to going into school. And I felt that, coming after 4 years of school, like your experience is at a different level now. And I think I could just do more with it in research.
Yeah, and that's amazing that you gave yourself that time to see what ocular research has in store too.
Yeah, absolutely.
Amazing. Yeah. So once you were certified in Canada and now ready to work in the field, what is that process like of finding a position somewhere as an optometrist or even opening up your own clinic? What was that process like and how did you navigate that?
Yeah, so once you get licensed, once you get board certified, then you have to get certified for your province. So once all that's out of the way, you can start looking at work opportunities in the interim and kind of be talking to employers saying, you know what, I'm going to be getting licensed any day now type thing. There's different types of modalities that you can choose in optometry. Most people will go into private practice, whether it's group or solo based. There's also the options of going into academia, hospital care settings, as well as working in corporate, like side by side with an optical retailer. Okay. So those are the main options that are available to optometrists once they graduate.
Okay. And so what were you interested in that point, and what was your first position from there?
My first position, just because I was still doing research when I'd picked up my first clinical position, so I was kind of doing an overlap. My first position was at a side-by-side with an optical. I was probably there for just under a year, and then I moved over to a private practice setting with another optometrist who owned the clinic. And then, like 7 years have gone by and I've kind of just dabbled in, a few different clinics now. And then currently recently I've taken over a lead position for a corporate company at one of their locations here in Toronto.
Amazing.
Yeah.
Amazing.
Yeah.
So can you give us a bit of an inside scoop on what your day-to-day looks like right now as an optometrist at the position that you're at right now, and in general, how you interact with clients and things like that?
Yeah, for sure. So I am currently in Toronto. I do work between two different practices. A day for me is, probably like I see about maybe 15 patients a day or so, which I think is pretty doable. Majority of my patients, I would say, are between the ages of 10 and 65. Generally, my population base is quite healthy. It's pretty just, generalized primary eye care.
I think it's important to talk about the lifestyle too, because sometimes when people are in any type of medicine, it can be very rigorous with the scheduling and things like that. So
right.
I would love to give a perspective of how optometry is, if you find that there's more of a balance, or how you're able to bring in balance for yourself too.
There absolutely is a balance with optometry, and I think that was something that really stood out when choosing fields. I know even just talking with my family, like they were like, you're going to have a good quality of life with optometry, and they're right. I normally don't need to take work home, like unless I've had like a really difficult case and I'm like thinking about that patient when I go home. That's different, but generally hours are like from 10 to 6, 9 to 5 depending on the clinic you're at, and then once you're home, you're home. There's not too much of an on-call situation unless you work in a hospital setting. So I think the quality of life, it's great.
Yeah, that's great to hear too. Recently, I noticed that you have been involved in some media opportunities. I saw you recently on CP24.
Yeah.
That was when the eclipse was happening. So people were very interested in how that was going to affect people's eyes and, eye safety with looking at the eclipse and everything like that. So I was interested in how you got involved in something like that, and if you have certain goals with being able to bring optometry to the media space as well.
Yeah, no, that's a great question. I will say that there's always a little bit of luck involved in things. You have to just be ready to take the opportunity when it comes.
Yeah.
The eclipse was like a phenomenal once in a lifetime experience, and it happened to come about on my day off. So, CP24 had reached out to my clinic asking, if there's an optometrist that would be willing to come speak about this, and so they had reached out to me, and I was nervous. nervous. I was thinking like, do I do it? Do I not do it? It's like, you're on live television. Like, what if you're giving information that isn't accurate?
Yeah.
But I was like, no, it's too good of an opportunity to not pursue. And so I'm super happy I did it. And, it's one of those things where I feel that as clinicians, it's very easy to get into a bubble where, you come in, you see patients, you go home, and that's it. And I think there's a certain amount of like redundancy that can kind of come in where like, you're grateful for what you do, but you're not really inspired anymore. And so I feel like something for me, especially this year, it's almost been like my year of yes, where it's like, if something's coming my way, like consider it. Don't just like let fear come in and say, I can't do it, or it's out of my comfort zone, I can't do it. And I think with that is like, I think when you take your first opportunity to do something that's like that's out of your comfort zone, it's like that one opportunity opens a door for like 5 other opportunities. And I feel like that's what's kind of happened. Like in terms of like just my interest in social media content has gone up, and then with that, other, like for example, my drug rep for one of my clinics, she's come in and she's asked me to do a filming for one of her segments for Bosch and Lomb. So I think a lot of opportunities come when you kind of keep yourself open-minded. So yeah, that's kind of been my journey this year.
Yeah, well, that's great to hear where you're at with your career too, and how you're bringing in different things. I appreciate that you talked about how sometimes it can get redundant, and you are really focused on bringing inspiration in other ways and allowing yourself to expand. I love the idea of, always evolving, always growing. So your year of yes, I'm really excited to see more of how that comes too.
Yeah.
That's great. So in terms of social media, you mentioned, do you have certain goals there? Are you wanting to bring like eye care education to the public with that? What kind of interest do you have?
Yeah, I mean, like I have a page online or on Instagram, and that's mainly just for fun. I mean, obviously the content I'm putting out there is factually correct information as well, but it's it's more so like it works in a couple ways. Like it brings patients in, it piques their interest, and it also helps me too. Like I have patients that have come in to see me before, and they're like, oh, I saw you on social media, or I saw you on CP24, or like I saw that you made a video about the solar eclipse, like just on your Instagram page. I thought that was really interesting. And so it's a nice feeling to know that it's like reaching people. And at the end of the day, like you kind of are your own walking business. Like, optometrists, majority of them I think are independently contracted. So we're self-employed. So, whatever you can do to, increase exposure of, who you are and what your services are, I think, that's great.
Yeah, that's amazing. I'm interested in knowing if you have these kind of conversations with fellow optometrists too, and how they have tried to expand their horizons. Maybe it's not social media, maybe it's networking or attending conferences that you might be part of as well. So in other ways, how do you find the network there, and what people are doing differently to find that kind of inspiration?
Yeah, that's actually a good question, because I will say that like there was my biggest challenge that I had when I came back to Canada was the fact that all of my colleagues in the network that I'd built thus far were all from the US. So all of them were American, right? And even though there was a couple Canadians in my cohort, they were mainly from BC and Alberta. So when I came back to Ontario, I was like, I really don't know anyone. And then the only way to really kind of get out of that is to just put yourself out there whenever you can, even if it's something as simple as, you've been invited to go to a continuing education lecture dinner for an hour. In that hour, you're going to meet so many other optometrists. A lot of times these talks are done by ophthalmologists, so you're introducing who you are to the community, and then you're building a rapport there. Or, same thing, like when your drug rep comes in to tell you about the newest contact lens on the market, you can, ask him or her, like, where can I get involved? I know that there's also, there was a time when I was living in the US where I was like, I want to do something beyond just practice. And I had reached out to a company that allows optometrists to write articles for them for online. And so now once in a while, like they will give me a topic to write about, and I'll write. So I think there's just different ways to put yourself out there, and then you get a lot back from that as well.
I love how you diversify your career too.
Yeah. Honestly, like it helps. I feel like every year I get more and more excited about my career. And I think that's because I continue to just look for opportunities opportunities that go beyond just 4 walls in a clinic.
Yeah, it really allows you to grow.
Exactly.
Yeah. And I think it's interesting too how you said that for optometry, you're constantly wanting to expose yourself and try to gain your clientele to being self-employed. So I'm interested, is it often a goal for people to have their own clinic as well, or are they often contracted? And, what's your take on that?
I think the assumption is that most optometrists will want to eventually open their own practice. And I think that's probably, from a clinical standpoint, at the highest level you can go.
Right.
I know personally, like I've contemplated it often. And I just feel like, it's obviously a big undertaking to open your own practice. And so I know that having been an associate for so many years, I was ready for something a little bit more involved, something that gave me a little bit more autonomy. And so I know that, for example, the job that I'm at right now, it allows me to do that because since I'm the managing optometrist there, I'm allowed to kind of have more say in, what kinds of services I want to offer, what kind of price points are we talking, or, who I want to hire as another associate. So there is a lot of added responsibility with that, and I've gotten a better understanding of what it means to make your goals. What are the financial obligations, what are your KPIs, your targets. And so it's given me a lot of exposure to that. And so I think that down the road, if I were to entertain the idea of opening a practice, at least I'm kind of coming in with a little bit more, knowledge.
Yeah.
But I would say for most people, their goal is to open their own.
Okay. And that's great that you can look for those type of managing positions and either get that experience or have that fulfillment in that role too.
Yeah, absolutely.
Where we're at right now in this conversation, I feel like that leads me to one of my questions that I had for this interview being how you feel like you define success. Because I think, especially being in any type of medical field, in some ways, I think just becoming the doctor, becoming the optometrist, that's your epitome of success and you've made it. But I love how we're being able to have this conversation where you can still grow and find success in different ways too. So I would love to hear how you've been defining success through your career.
Yeah, that's actually a really, really great question. And you're absolutely right. Some people, it's like, I want to just get that designation, see that I have it under my belt. And of course, there's something to be, you should feel proud about that. It took a long time to get that. So, it's a lot of hard work that got you there. Personally, for me, it's more about, am I feeling fulfilled? I've had the designation now for about 10 years. And that fulfillment that I feel now probably only came to be probably in the last 2-3 years, if I'm being honest, just because it was just kind of, rinse and repeat type thing. And it's one of those things where I know patients leave happy and thankful for your services, but then you're also while I'm here and I'm in my prime, my purpose can be so much bigger than this. My outreach can be so much bigger than this. And of course, to each their own. Not everyone has that calling, and that's fine. Just for me, I realized that there's so many other ways I would like to reach people, again, just beyond my own clinic walls. And so I think success for me is when I've been able to affect multiple people in different ways. They don't necessarily have to be my patient, in my exam room, but, just being able to help as many as I can in whichever way I can.
Yeah. I think sometimes when people have large goals of, whether it be a lawyer or a doctor, it's important to know your purpose there. And I feel like you've really been able to show that because you gave yourself the time to even see what kind of specialization you wanted to do, and you really found a love for eye care and things like that. And you, as you said, you were fascinated by it.
Yeah.
And given yourself the room to grow too. So I think that it's important when people are on these kind of journeys to stay true to their purpose and what makes them fulfilled at the end of the day.
Yeah, absolutely.
Yeah. So I would love to also hear if you have any general advice or specific advice for students who are interested in embarking on a similar journey, or might already be going through it right now. And even if you're thinking back to maybe the most stressful of times too.
Yeah.
If you have any advice for similar people.
Absolutely. So for anyone who's choosing to go to the U.S. for their education, obviously the U.S. has a wealth of opportunity there, and I do think the scope of practice in the States is in some ways superior to Canadian education. But the thing is that the cost for the States has gone up significantly. I was lucky enough that when I went, our dollar was relatively at par, and it wasn't so, financing my schooling wasn't as tough. So I think there might be a challenge for students there, in which case I encourage them to seek as much support as they can, just financially. And then I think, like, as I was mentioning, I did feel that my transition coming back to Canada was a little bit tough just in terms of developing that network, because I feel like it's very easy to feel isolated and a little bit lonely. And at the end of the day, as a student, you're used to having someone, if you make a mistake, you've got an attending or a resident doctor who will cover for you,
Yeah.
But when you're in the real world, you don't have that anymore. So it's a little bit nerve-wracking. And then when you also don't have a support system, like if you've got a complicated case and you're like, I would love to have a colleague that I could share this with. And when you first start practicing, you don't necessarily have that right away. And so that's going back to what I was saying, putting yourself out there. It's not just about securing the job. It's like, going to these meetings, interacting with your pharmaceutical reps, asking them about, how can I get involved? What are the other opportunities? And really, you're going to meet so many people that way. And then it just makes it easier. Like, the road gets a lot easier when you have a really good network.
Yeah. And where do you find those meetings to attend, or conferences even?
Usually if you go to the college's website, there will be links to where you can sign up for, just to be kind of in the loop,
right,
what's happening near you. Even if you, honestly, pharmaceutical reps are really great that way as well, because they often have knowledge from working at multiple different clinics, and they often will tell me, hey, there's a dinner happening with Dr. So-and-so. It's going to be a great talk. You should come. And then, so it's just really about mingling and, just asking around.
Yeah, that's great. Yeah. And looking at everyone as an asset, as a support system, sometimes maybe people will just think, oh, I'll just connect with other optometrists. But then seeing the value in your pharmaceutical reps too, that really shows how you can expand your network.
Yeah,
that's
for
amazing.
Sure. Yeah.
I think this is a great place for me to ask my last question.
Sure.
Which is, what are your hopes for your future career development, and what do you hope to achieve?
I think my hope for my personal career journey, it's one of those things where, I thought I knew what resonates with me, but then the moment I started allowing to take on more opportunities, I feel like I resonate with so many other ideas now. So I'm kind of just letting that guide me. Like I said, I do kind of contemplate opening my own practice at some point. But I've just recently taken on a new role, which I absolutely love. So I basically see like where am I being called to? But the intent is to just keep growing. In whichever way that might be.
Yeah, I love that message. That's something that I try to put out in general. So that's great to have you on and to give us your insight and to mentor our audience. I know that this is going to be so insightful. So thank you so much, Neety, for coming on.
Thank you so much for having me.
Thank you so much to Dr. Neety Kochar for coming on the Mentorship podcast. This was such a great conversation about the path to becoming an optometrist and how to continue growing even once you achieve such a big milestone. I hope you were able to find this episode both informative and inspirational. To connect with Neety, you can find her social media page linked in the episode description. There you will also find our anonymous feedback form where you can tell us what you would like to see more of in future podcast episodes. We will be back in 2 weeks with our next episode, where we will be joined by an incredible representative of the fashion industry, so be sure to tune in. In the meantime, follow us on @MentProjects on all social media platforms for updates and more mentorship resources. Thank you so much for listening.